Hi, my name is Michelle Hojnicki, and I'm a neonatologist here at Johns Hopkins All Children's Hospital and an assistant professor of pediatrics at the Johns Hopkins School of Medicine. One of my academic and research interests is to identify early non-invasive prognostic biomarkers of gastrointestinal complications in high-risk babies, such as our premature babies and those with critical congenital heart disease. One of my goals is to minimize feeding interruptions, as we know how important early but safe feeding is in these high-risk infants. I had the opportunity to work with the Center for Translational Research here at Johns Hopkins All Children's Hospital to explore urinary inflammatory biomarkers for necrotizing enterocolitis and spontaneous intestinal perforation, both of which are complications that could occur in premature infants. We additionally had the opportunity to present our work at the Pediatric Academic Society Conference this past April in Honolulu, Hawaii. This work is important as necrotizing enterocolitis and spontaneous intestinal perforation can be a major cause of morbidity and mortality in premature infants, and there is a critical need to identify early non-invasive prognostic biomarkers. To summarize our study, we performed a secondary analysis of a prospective cohort study in infants born less than 28 weeks. These infants had urine collected non-invasively and directly from their diaper at standard intervals in the first 72 hours of life. And our objective was to characterize the urine inflammatory proteomic profile to determine if these early biomarkers could distinguish those infants who did end up developing necrotizing enterocolitis or spontaneous intestinal perforation from those who did not. In our cohort, 8 infants developed necrotizing enterocolitis or spontaneous intestinal perforation at some point during their hospitalization, and we observed an elevation of the urine protein markers of ORL1 and TNSF12 in those first 72 hours of life. We used a targeted cytokine protein assay. ORL1 has been shown to contribute to the body's inflammatory response during times of stress, and TNSF12 has been elevated in times of intestinal and epithelial injury. We additionally found additional proteins that were elevated and thought to be involved in the gastrointestinal inflammation response as well as the immune response. This work is an important starting place for future studies and validation, as these non-invasive biomarkers could potentially aid in early risk stratification and early bedside monitoring and diagnosis. And they may also reveal pathways for future studies to ultimately help these small babies. We are excited to continue to work on this as a team in the future. Thank you.